The field of medical research is great, right? I mean, these top scientists come together with the aim of developing new medicines and medical procedures to help improve our lives. We all get our specific individual doses to help us feel best in the quickest time possible, right? Well, not entirely. Actually, research, which we will discuss later on, has shown that the field of medical research can be very unequal at times. How? Well, let me tell you. It all boils down to the simple, if slightly unsettling fact. Most drugs are prescribed to men and women in the same doses, even though their biology is widely different. For example, women sustain a higher blood concentration and generally have a higher body fat percentage than men. In a study from the University of Chicago, Beckerley, and the University of California, they found a gender gap in drug doses for 86 medications approved by the FDA. That is a lot of medicine, which may not end up helping as much as it was intended. Now, let's look at an example of a study carried out to learn more about this gender gap.
This is Irving Zucker, PhD and Professor Emeritus of Psychology and Integrative Biology at the University of Berkeley. He discovered that the drug zolpidem, often used for sleep medication, was causing serious side effects in women. He found that women were 5 times more likely to risk driving impairment the morning after taking the 10 milligrams of medication. Only after this discovery was the dosage of zolpidem reduced by 50% for women. Zucker then started analysing studies in which women were given the same dosage of medication as men, where Professor Brian Prendergast found that in over 90% of causes, women experience stronger and more adverse reactions than men. This may be because men and women metabolize drugs differently due to differences in hormones, body fat percentage, etc. As we can see from Zucker's research, the effects of this inequality are more adverse reactions in women. A shocking figure is that though women make up around 47% of the 6.7 million people in the UK with heart disease, they accounted for only 28% of candidates for the 500 key heart trials between 1996 and 2015, according to one Canadian study. Don't forget, though, that this inequality concerns everyone, and men have found to be underrepresented in medical trials for things such as preventative medicines and psychiatry, mainly things concerning mental health and trauma. However, this gender gap also affects money. Millions are spent to conduct these medical trials, so to neglect one gender in the trial population is just a waste of money. So I'm sure you get the gist now. Medical research is great, but it definitely has some room for improvement, especially in ensuring genders are equally represented in trials. And as great as it is to talk about it for 3 minutes, there must be some way to help eliminate this inequality. So what can we do? Dr. Jessica Steinberg, a medical resident in the Department of Obstetrics and Gynecology at Northwestern University Feinberg School of Medicine, conducted a study which analysed 20,020 US clinical trials between 2000 and 2020 to study the underrepresentation of women in particular in these trials.
She hoped her research would get scientists and physicians to ask, what is happening in my field and how can I address it? But since we certainly don't have the qualifications, time or money to conduct such a large trial, and you might not either, maybe there's something else we can do. Well, the best thing is actually to bring the situation to attention. Feel free to share what you've learned with friends and family, or maybe even do some of your own research if you're interested. If people start talking about the gender bias in clinical trials, awareness is raised, and the more likely it becomes that the problem can be resolved.